Hello, I'm Jeff Gold, and I have the incredible honor of serving as the Chancellor here at UNMC. And I just wanted to take this opportunity to briefly welcome everybody to this virtual awards ceremony and to, of course, congratulate the awards winner. It was not too long ago, just earlier this week, that we officially cut the ribbon, making the Davis Global Center on a formal part of the UNMC campus. However, this is a concept that started years and years ago, and actually on the back of a table napkin, we drew out the scheme of what it would take to turn this dream into a reality. Earlier this week, that dream formally became a reality, where we got an opportunity to thank the public and private partners, the philanthropists, and many others that made this building occur. However, at the end of the day, as beautiful as the building is, as advanced as the technology is, it is unquestionably the people that build what it is today and that will build the future for tomorrow. And so today, as part of the first annual Innovation Awards ceremony, we will recognize those that have been instrumental in innovating, in using the technology, in bringing together the very best of the medical sciences, with illustration and virtual and augmented reality to help build the future of health professions education. So with that, I could easily conclude my opening remarks to thank the organizers, of course, and to wish all the award winners well. However, I do have one other thing that I wish to do. There are two individuals that have made this project possible. They have not only helped to plan the building, work with the architects, the engineers, to help recruit the amazing staff, but to help vision the future. And that, of course, is Ben and Pam. And so I'd like to invite both of you. I have a very small gift for both of you, and you will have to open it a little bit later, but I will tell you it is a structural part of the building. So you will now own a structural part of the building as much as the building owns so much of your intent to make this possible. Oh, and by the way, mask up, Nebraska.
Thank you so much. Thank you.
Hold on to your brick.
I will.
Congratulations. Thank you. Thank you.
Oh, my goodness. Thank you so much, Dr. Gold. That was a total surprise, everybody. It was certainly unscripted. But I'm Pam Boyers. I'm Associate Vice Chancellor for Clinical Simulation, and it's my pleasure to formally welcome you all to this inaugural iEXCEL Innovation Award ceremony. We're absolutely delighted to be able to honor our faculty today, those who have stepped forward to help us get this place going. And by going, I mean teaching and actively involving students in the learning process. We also want to welcome our friends and family. We have encouraged our awardees to invite their friends and family because we all know only too well how important it is to have support as you tackle all the changes that are happening in society and also any large and major project. So we're broadcasting this live event from the Davis Global Center, actually from the Holographic Theater. And due to COVID restrictions, we are going to be asking everyone to wear masks. And we're also only actually having the award winners, the main award winners attend. We also have honorable mention awardees who should not be overlooked. But for safety's sake, we've asked them all to join by Zoom. So when 5 years ago, our visionary leaders at UNMC and Nebraska Medicine were thinking about the future, they knew beyond a shadow of doubt that the future was going to change forever. They knew that there would be tremendous advances in technology, in digitalization, and the visualization of data. And so they began to plan what should the educational arena look like for the future. And this especially included the teaching and learning environment for our faculty, but also for our students. And they knew that we were going to need safe places for students to learn and practice and become competent. And thus the Davis Global Center concept was born, and this is where we are today. So now in 2020, we have realistic simulated healthcare settings where we can simulate any kind of scenario in healthcare, and our faculty can help our students learn everything that they need to know about how to take care of patients safely, compassionately, and competently. So it takes change, however. It's very, very different to teach using simulation than it is to teach by lecture or even in the clinical setting. So we really, really value our pioneers. We value tremendously those faculty who have stepped forward. We call them fondly the early adopters to find new ways of teaching using this tremendous technology and bringing learning to life. So it's my pleasure now to invite Dr. Deli Davis to say a few words about how he sees things from his perspective as the Vice Chancellor for Academic Affairs. Dr. Davis.
Thank you very much, Dr. Byers. 7 years ago, Chancellor Gold came to UNMC with a vision for an innovative new program called iEXCEL, the Interprofessional Experiential Center for Enduring Learning. 5 years ago, Dr. Byers joined our team, and she and multiple others have made the vision for iEXCEL become a partial reality this week with the opening of the Davis Global Center. I say partly realized because we have always known that the power of iEXCEL can only be partly realized through the extraordinary facilities that were just commissioned this past week. Without the ingenuity of the people, the faculty, staff, and students who are going to be working here, the full and total value and promise of iEXCEL will never be realized. So over the past 5 years, we have been supported by a guiding coalition known as the Strategic Advisory Group consisting of the college deans, leadership from the Interprofessional Academy of Educators, the IPE Committee, iEXCEL, IT, the NU Foundation, and myself. This group has recognized the need to highlight our faculty, staff, and students, especially those who are innovators and early adopters of the iEXCEL technology and principles. So these awards that have been given out today are the iEXCEL Innovation Awards, and the criteria for them are educational research projects that are focused on novel, competency-based training and assessment methods, innovative experiential learning modules that use virtual and augmented reality or other online-based technology, longitudinal interprofessional simulation experiences for students, telehealth, telementoring, teleprecepting related educational research that enhances student learning and all the outcomes of care, simulation-based training or intervention projects designed to impact patient safety and the quality of care, guest lectures and symposia that promote human factors research, pilot innovation projects that lead to new grants, creation of modules including toolkits for testing proficiency, and project support materials, travel to conferences, as well as staff time to expand the reach of iEXCEL to UNMC faculty and students, Nebraska Medicine and its clinical partners across Nebraska and the world. Training sessions must have taken place inside the Davis Global Center for our awardees to be receiving an award today. So these awardees, our iEXCEL awardees today, have been selected based on the criteria I just described by an iEXCEL Innovation Awards Committee, which had representation from iEXCEL staff from each department of simulation modalities. I would like to leave you with a quote from Dr. Albert Szent-Györgyi, who said that innovation is seeing what everyone else has seen and thinking what nobody else has thought. I want to congratulate all of you getting these awards today, and I encourage you to keep on using iEXCEL and thinking what no one else is saying. Dr. Byers.
Thank you so much, Dr. Davis, and you have been so instrumental and supportive in the development of iEXCEL. We appreciate that. So without our supporters and our donors, we would not be here today. So I'm going to ask Dr. Amy Volk, who is Senior Vice President, University of Nebraska Foundation, to say a few words about our donors and on behalf of our donors. Amy.
Good afternoon. It's an honor for me to be here today representing the donors who've built this magnificent facility, and importantly, those donors who established these innovation awards, and we celebrate with you today. I know I speak for these donors that they would love nothing more than to be here personally to congratulate you and to hear about the ways that you're utilizing the technology and the expertise in the Davis Global Center to change the world. If they were here, they'd want you to know how excited they are about the work that you're doing. They knew it wouldn't be easy because iEXCEL concepts disrupt the traditional way of teaching. They knew that that investing in that would make a difference, and they asked how they could help. I'd like to tell you a little about these donors. The Hitchcock Foundation. The Hitchcock Foundation, led by trustee Neely Kuntz, has been investing in important projects in Omaha since 1943, and they see these innovation awards as an extension of that important investment in our community. Dr. Dennis and Ann Ross, both are alums of UNMC, and they brought their experience as students here along with many years of taking care of patients. They were enthusiastic about embracing the concepts of this technology in interprofessional education, and they know it will make a difference in patient care. AVI SPL, a global industry collaborator whose expertise and vision has been key to the Davis Global Center and across our statewide campus. What an honor to have the largest provider of collaborative technology solutions in the world investing in innovation awards to recognize your work. And finally, an anonymous donor representing the estate of a Nebraska businessman whose interest is in supporting healthcare. This gift was influenced by another one of our alums whose consulting with this foundation helped them understand that simulation training in highly technical and delicate situations was important to good outcomes. I'd like to take a moment for you to thank these donors. Remember, these donors are on the sidelines. They're here cheering you on, and they're partners in this work that you do. I hope we can continue to tell them about the outcomes that you will have, and remember that they want to hear from you. So congratulations on these awards, and thank you for letting me be here.
Amy, thank you for your work with the donors, because we truly value them and you for enabling us to do this kind of activity. So thank you. So we're going to move on now to the formal award ceremony. There are 5 different awards. Congratulations to our simulation pioneers. I'm going to now hand over to Mr. Ben Stobie.
Hi, and welcome again to the iEXCEL Impact Award. It is my pleasure to introduce and interview the team that has worked so hard over the last 6-7 months with iEXCEL and helping us to create a unique program, and we felt it important that they got recognized with this iEXCEL Impact Award. I will ask questions of each individual, but first of all, let me go over a couple items that this program helped with. So the project itself helped to develop and facilitate a nasopharyngeal swab training for over 300 staff members from Nebraska Medicine, created an evidence-based instructional video on nasopharyngeal swabbing, and hosted a live event from the Davis Global Center from this room, which has reached over 4,400 people. So congratulations to this team. So first, let me go to Dr. Pate. Dr. Pate, the initial onset of COVID-19 pandemic, the iEXCEL team was working remotely, but remained poised to help in the development and the deployment of just-in-time training. In the early days of coronavirus pandemic, your team recognized the need to conduct some level of training in nasal swab specimen collection. Can you speak about what led this team to recognize this training need, as well as the development process and how long it took the first meeting to start to the first training that took place?
First of all, thank you, Ben. Very good questions, and really it's been an exciting journey. As is true in life in general, we often learn the most through adversity and as we see adversity as opportunity. What our team found was that there were some adverse events that were occurring related to nasopharyngeal swabbing of patients in the hospital. After investigating this process, we realized that the procedure itself had been performed incorrectly a number of times, and we saw that as an opportunity to help our colleagues in providing better, safer care to our patients. So Dr. Barnes, Dr. Dowdall, and myself found a morning to meet together to discuss this opportunity and find ways that we could help our patients, and immediately contacted your team here at the Davis Global Center. By late that afternoon, we had come up with a plan to perform hands-on training for our colleagues and staff at the hospital and surrounding clinics and so forth. And also had already produced a rough video to demonstrate correct procedures and to use that and incorporate that into the training module. Overall, from the time that we first started speaking of this process and of this opportunity to the first training program, I think it was about a week from that first discussion we had in our offices to the time that we had a formalized instructional plan in place.
Well, we'd like to thank you for your commitment to this project. We couldn't have done it without you. You showed the desire, the commitment, and the passion to create this and to see the impact that this could have for our community and the state of Nebraska itself. Thank you very much.
Thank you.
Now, Dr. Barnes, the Davis Global Center was purposely designed for learners to have a safe place to practice, make mistakes, ask questions, and hone skills. Can you speak about the training and some of the aha moments that you realized during the training and the swabbing procedure process? And can you also describe the collaboration that took place for the development of the nasopharyngeal swabbing model?
Sure. Yes, thank you. Thank you, Ben, and thank you to the Davis Global Center for this award. We are truly honored. And thanks again to all our donors who have contributed to this building, this vision. We would not have been able to do any of this without your support. Ben, as you mentioned, there were many aha moments during the process. I feel probably one of the biggest, the two that really came to mind were one we were faced with. We received some questions throughout the training where folks would say, well, what do we do in the case where we're swabbing someone in a car? And so we realized we needed to address that in our model, in our simulation, and in our instructional curriculum. And so that was one of the things is we really had to think about, well, where is this going to be done? We also realized that, prior to February, not many people had ever performed this procedure, really knew where the nasopharynx was. So we really needed to sort of start with the anatomy and help people understand the anatomy. So we performed or kind of simulated some models and diagrams and did very anatomically correct overlays in order to fully appreciate that. And then the next aha moment, I think, was when we said we've got two great simulators here. We've got two mannequins. Both of them are fairly okay, but we could definitely do better. And so I think that's kind of what led to our discussions together and the collaboration with the Chamberlain Group to create the new mannequin model that we've been working diligently on for the last couple of months. We kind of thought, gosh, I think there's a better way of doing this. Let's take these two mannequins, improve the fidelity, make this a really high fidelity training model for people that we could use not just here at the Nebraska Medicine, but we have a vision that it might be something that will be helpful worldwide for folks, because we understand fully that this disease is not going away. We also recognize that this technique is important for other types of disease process, infectious disease processes. So it's definitely a worthwhile endeavor, and it's been a fun journey.
Great, thank you. And again, I would be remiss if I didn't thank each one of you for every time I sent an email, every time I sent a text, that you answered right away. And I think that's what showed the commitment and the level for us to be able to get this project up and running so fast. So Dr. Dowdle, moving on to you. The impact of training on patient safety is a key driver for the iEXCEL program. Your team worked very closely with the iEXCEL team to create and deliver a variety of training programs for local, rural, and the community to enhance the safe practice of the nasopharyngeal training. Can you speak about some of the groups trained and how we were able to connect to individuals across the state to deliver the hands-on training, but also virtual training so they could get the information?
Thank you, Ben, and thank you very much to the entire team here at iEXCEL. We also need to thank our colleagues and partners, the ENT attendings, and our residents who showed up to train as well. We tried to create an educational environment of safety as well, because what we realized quite quickly is that many people did not have training in this procedure. And it was hard for experienced providers who felt like they should be able to perform a relatively simple task to admit that they actually had not themselves had any training. And so we tried to create an environment where people could say, you know what, I don't know. I haven't gotten training on this. And we hope that they felt comfortable. And in the room, sometimes we would have anywhere from very experienced ICU nurses to ER providers to patient care techs and medical assistants. And so the opportunity for interprofessional education was one that we very much enjoyed and tried to meet kind of each learner where they were at. And so then we tried to carry that environment of safety and discussion and try to take it on the road virtually. And so whether we did that in phone calls with the National Guard, and they could say, you know what, our swab looks different from your swab. Let's talk about how that is. Let's talk about the differences between performing this in a car versus an ICU bed. So we tried to take each different constituency. We also trained and had discussions with folks from the Department of Public Health, and it was another aha moment for us that they had actually more training and swabbing for STDs than perhaps in the nose. And so it was a fun group to train. They educated us, and they realized that that wasn't nasopharyngeal swabbing sort of wasn't something they were familiar with. So we learned just as much from each of our groups of learners, probably, about how to teach and what their educational needs are. So we really tried to scale the experiences and the questions and back and forth discussions that we had in this building and tried to create that environment virtually, and tried to be extremely open and responsive to groups that reached out to us that needed assistance, and we tried to very creatively meet those needs.
Thank you. I would also like to thank you for being our nasal swab model in the video and doing it with such grace.
It's easy to get swabbed by Dr. Barnes.
So we'll move on to Dr. Carlson. The iEXCEL has been working to develop learner assessments that help to measure confidence and competence to ensure we are recognizing the impact of training on clinical care. The team worked on capturing this data right from the beginning. Can you explain the process developed and maybe some of the results that you recognized as we did some of this research?
Thanks, Ben. It's truly an honor for me to be here and receive this award and to work with this amazing team. I got a call on a Saturday. They were here in the theater working on the video and wanted to work on some evaluation methods. So we looked at doing a pre-post model, and we knew that the participants did not have a lot of training in this area because this is not a common procedure. So one of the pre-test questions that we asked was if they had performed this procedure in the last 3 months, and we found that only 25% of them had performed it in the last 3 months. So we knew that we had a knowledge and a task gap, and so we were looking at trying to improve the knowledge level of trajectory and also depth, because those are important in this nasopharyngeal swab procedure. And then we were also looking at if they were comfortable in performing the procedure as well. So from the pre to post, we found that our participants, we had over 300 participate in the pre and post, and we found that their comfort level increased 1.5 points on a 5-point scale. So we were very thrilled that the training was effective. They also felt that the video and the simulation helped them in their efforts to learn how to do this procedure. There's a couple of dissemination projects that have come out of this. So we're working on about 3 different manuscripts, and one is in review, and a second one we're getting ready to submit the second revision to the Journal of Continuing Health Professions. So part of my job was to help with the dissemination of the information and our results of the training. And I couldn't have done it without the team, and I'm just really thrilled to work with these amazing group of people and our partners at iEXCEL.
Okay. Again, let me thank you all, congratulate you again, and just hope we can do more projects like this in the future.
Absolutely.
Thank you very much.
Thank you.
And now let's go ahead and show the honorable mention awardees of this award.
This award is for the iEXCEL Nebraska Medicine Partnership Award. Our award winner for this is Dr. Justin Siebler, Chief of Orthopedic Trauma. My name is Jenny Bokite, and I'm the supervisor for the program for the surgical floor. Dr. Siebler, can you tell us why you felt simulation was an important component to your orthopedic residents?
Yes, I will, Jenny. Thank you. First, I would just like to thank everybody for this award, including the donors and this amazing facility. I think we would all agree that the surgical specialties lend itself very well to simulation, both in simulated operating rooms and through computer simulation. Orthopedics field in general has pushed for more of these opportunities, and we have in our department as well. In order to allow training for our students and our residents to work through these complicated procedures safely before they get into the operating room with live patients is becoming a more critical component to their training.
What contributed to your desire to add visualization to its mission?
For some time, we have had the ability to work with cadaveric specimens. However, with better and better computer technology, being able to add some of these visualization components to it to work through these sequences prior to utilizing cadavers has been important. Also, in order to allow more repetition and to ultimately decrease some of the cost with this.
Dr. Siebler, talk to us a little bit about the future direction of your curriculum that we've been planning.
Right now, we're working with multiple components in terms of VR and AR technology, and with the amazing surgical simulation center we have on the 3rd floor in the new building. I really look forward to working with more and more groups, multidisciplinary teams in the operating room that we have up there, and just overall continuing training for all of our students and residents as we all learn and work through this amazing facility and staff that we have.
What was your first impression of the Davis Global Center when you came here?
Well, I think I can speak for all of my partners in that it's really just a wow. Especially coming on to the OR surgical floor here in the building. It is amazing, the facilities. I think it's not hard to imagine numerous different opportunities here for training, not only for those of us locally within the university, but regionally and nationally as well.
So when your residents leave here after a lab, what are the reactions that they're voicing to you?
The residents that are about ready to graduate are very disappointed that they won't be able to be here for more time. Our junior residents are very excited about the times they will be able to spend here over the next few years. They are too wowed.
Well, Dr. Siebler, I want to congratulate you and thank you for your time.
Thank you very much, and thank you again for this award.
Now let's take a second to take a look at our honorable mentions.
Hello, my name is Bill Glass. I'm the Artistic Director for iEXCEL, and I'd like to welcome Dr. Yanis Hatzis. Sorry if I mispronounced your name. I'm used to referring to you as Yanis, but we're here to congratulate you on the recipient of the Clinical Innovation Award. So how is working with the iEXCEL staff and technology located in the Davis Global Center then for you and your team?
First of all, let me thank you, Bill, for this great honor. I have to share a very short story here that everything started in a year and a half ago when I visited Dr. Gold in his office. I shared with him our NIH funded project at that point about stent simulations. And then he told me, you made my day. This is very directly linked to the iEXCEL purposes. So he connected me with Dr. Boyers. She then shared the same excitement, and she connected me with you, and you with your group, with Christine Almond. And here we go today. We celebrate the award, but beyond that, we celebrate a very productive, a very amazing collaboration between a very clinically oriented clinical group, ours, and iEXCEL. And that's a great moment for us. So coming to your point about how working with iEXCEL helped us change the teaching experience with our fellows. I have to say that we live in an era of simulations, artificial intelligence, extended reality. We coined recently the term ACER to encompass these technologies. And iEXCEL is home to these technologies. And through these technologies, we can change the landscape of the learning experience. The traditional way of learning has been a unidirectional flow of dry knowledge from a teacher, a board, a 2D print media like a book, to trainees. Now we change the landscape. Now we talk about using simulations, using AI, using extended reality capabilities to help the students, the trainees, to learn in less time, faster, more, and understand better. So faster, more, better. That's very, very important. It's changing the whole landscape of learning. And all these things starts from here, from iEXCEL. It's very well organized in a very systematic way, this new learning experience, and radiates through the world in the upcoming years.
Thank you. And can you talk about how the technology in the Davis Global Center has improved patient outcomes?
Yes, so the key word here is planning. There is a famous quote by Benjamin Franklin that by failing to prepare, you are preparing to fail. And that's what we offer here in iEXCEL. We offer opportunities to plan. We can sit together in simulated mode with my colleagues, with my colleague cardiologists, with cardiothoracic surgeons, and sit together and understand the cardiac pathologies. Plan together, discuss, and explore alternative scenario, alternative therapeutic strategies, come up with the best possible scenario and strategy for a given patient, a precision medicine approach, and then execute in the clinical practice. And that's very important because hopefully this way you can achieve the best possible clinical outcomes for our patients.
All right, thank you. And what concepts have been the most difficult for you to kind of communicate to your students or residents and fellows, and how has the technology helped with that?
Yeah, absolutely. So coming to my specialty, cardiology, we try to explain to the students the 3D complexity of cardiac anatomy, coronary geography, coronary stenting. Those are very difficult concepts for them to understand, especially through 2D drawings or 2D X-ray images. Now, with incorporation of the simulations, the extended reality, AI, the fly-through capabilities, the CAD wall, and the interactive tools, we can help them. We can help our trainees better grasp the 3D complexity of the heart anatomy. They can better understand the different geographic projections and how each projection views the heart from a different viewpoint. They can better understand how the stent looks like, how the balloon inflates, how the stent expands, how the stent touches the wall, how the whole stent behaves, especially in the branching arteries. This is a whole new experience for them and changes the whole learning experience.
Very good, thank you. And what kind of feedback have you gotten from the students that have had a chance to experience some of this?
Well, they just love it. They're excited because they have the opportunity to have a virtual hands-on experience in a very safe, very forgiving environment, without X-ray, without radiation, without contrast. They can play with different angiographic projections. They can play with different scenario with stenting in coronary arteries. They feel this way more engaged. They are more interested. They elevate their curiosity, their participation. They're stimulated to ask questions, and they're pushed to come up with solutions. It's just exciting.
Well, thank you, Dr. Chazizis. And now we'd like to take a look at some of the honorable mention award winners.
I'm Samantha Rogers, the Clinical Simulation Program Supervisor, and I'm here with Dr. Amy Cutright from Emergency Medicine to present the iEXCEL Academic Award. Dr. Cutright is the Program Director for the Acute Care Block. Dr. Cutright, can you tell me how the Acute Care Block was developed?
Thank you, Sam. I would just like to take a moment to thank everyone, including our donors, for this amazing building and for this award. It's an incredible honor. We developed the Acute Care Block. It's a new element within the curriculum in the College of Medicine designed to help students who are transitioning from the preclinical years of training into the clinical years of training. The Acute Care Block was designed to help them with this and to give them both a refresher in procedural skills and physical exam and diagnosis skills right before they begin their service in clinics and on the wards with live patients on a regular basis.
And can you tell me, why did you choose to use a mix of simulation, lectures, and hands-on training?
We hope that our curriculum would be as useful to the students moving forward as possible, and the best way to do that is to try and make it as real life as possible. Since the students are not seeing live patients in our 2-week curriculum, we elected to go with as many different varieties of experiences that would prepare them for the real life clinical environments they were going to encounter 2 weeks after the curriculum concluded. So that is why we chose to go with a variety of formats, but to emphasize hands-on skills and simulation for the majority of the activities we were planning.
And I know each year you ask the students to evaluate the block. Do you notice any common themes in the feedback you received, and did anything surprise you?
The students generally had very positive feedback on our curriculum, which we were very excited to see. I designed some clinical simulations for them to participate in, mostly as a trial. I was not expecting preclinical students who had not actually taken care of live patients yet to really understand or probably glean as much usefulness out of a true clinical simulation. The surprise to me in the feedback was that their hands down favorite part of the block was actually the simulations that they did. And so we are working on methods to include more and more simulation with them moving forward because of that feedback.
Right. How do you think this block contributes to the student's education and the patient's experience?
I think it's an incredible training. It helps kind of gel together all of the learning that the students have done so far. It also gives them the opportunity to start to think about transitioning what they are going to do from looking at things from a organ systems perspective, which is how they've been taught prior. It's a great way to think about medicine in general. However, patients do not conveniently come in with the complaint that they have a malfunction with their respiratory system. They come in with shortness of breath or cough or other symptoms. So it's a great chance for us to start to think in a method where the students are going, okay, they're going to come in with a complaint, and I'm going to get a history, and I'm going to do a physical exam, and I'm going to develop a plan to care for and work up the problems that these patients have. And it starts them off on that journey and prepares them for some clinical things that they're going to see so that they have a jump start when they hit the ground running for clinical rotations.
Great. Thank you, Dr. Cutright.
Thank you. I really appreciate it.
Now let's take a look at the honorable mentions. Hello, I'm Samantha Rogers again, and I'm here with Dr. Jason Langenfeld. He's with the Department of Emergency Medicine, and he is the simulation director for the residency program. Now, Jason, you run a lot of creative simulations on a monthly basis. Can you tell us, how do you come up with all of your ideas?
Well, I think like anything, we start with the end in mind. So we look at what the objective is for that learning experience. And so in emergency medicine, we don't know what's going to walk in the door ever. So we spend a fair amount of time looking at the low frequency, high risk procedures as well as our bread and butter. And I think my favorite is when a resident or a provider or even nursing staff or somebody brings me a case and says, this is something that I think would be really helpful to have in your learning process. And we get to take that and turn it into a scenario. And then we take those ideas and try to sometimes turn them on their head and have a little bit of fun with them at the same time.
Do you and your residents have a favorite simulation scenario or activity you've done?
So interestingly, we ran simulation this morning and it went fantastic, thank you, to all the iEXCEL and Davis Global Center help. You know, I asked and I got about 20 different answers. And so the funny part is I think they like the things that are fun and entertaining. We did an escape room, which was fantastic. They enjoy the holiday sims. We tend to focus on Christmas and Halloween especially, and sort of the different outdoor simulation opportunities that we have. But every resident takes something just a little bit, and student takes something just a little bit different from those sims. So I was intrigued to hear that one may have a favorite that I wouldn't have expected. So I think all of them really hit someone close to home.
As you mentioned, you do a lot of out-of-the-box simulations, such as escape rooms, Halloween-themed sims. We do an outdoor sim day. What do you think your residents take away from these out-of-the-box as opposed to your typical clinical sims?
Well, I think everyone likes to take class outside, and I think that everybody enjoys having some fun with it. But what we try to do, especially in those, is to focus on sort of the teamwork, whether that's our community partners in kind of an interprofessional large-scale sim like the outdoor sim days or EMS days that we've had, or really focus on the teamwork within our working groups in some of the smaller sims. And so, you know, really, I think the importance there is to remember that we're all very interdependent when it comes to caring for patients, and that this really is a team sport. And that helps to reinforce that and give us opportunities to train in that environment.
And this kind of brings us to our next question. How do your simulations impact the residents' clinical roles and the experience of the patients?
I've heard it mentioned multiple times, even today, that simulation is a wonderful and safe space to learn, to practice, and to fail. And we provide that opportunity with clear instruction and learning objectives and feedback so that those learners, be them students, residents, faculty, when they get into the clinical environment, they have both the competence and the confidence to be able to care for patients the best that they can. And I think at the end of the day, that makes for better patient care and patient safety.
Well, congratulations, Dr. Langenfeld, and we look forward to more and more simulations.
We'll keep coming back. Thank you very much.
Now let's take a look at some of the honorable mentions for the Collaboration Award.
Well, hello again. This brings our inaugural iEXCEL Innovation Award ceremony to a close. I do hope you've enjoyed seeing the achievements and the accomplishments of our talented faculty. They're so dedicated. They so care about providing the right kind of care and the right kind of education. So once again, we appreciate everyone who checked in to view the ceremony, but especially thanks to our faculty and thanks to those wonderful donors who have made this possible. We will look forward to next year. Thank you.